Next up, we have Andrea McBeth, who's going to tell us about the human holobiome. Did I get that right? A philosophy of medicine through the lens of the microbiome.
If I asked you to eat poop, would you do it? What if I told you it could save your life? Surprisingly, many of the patients I have worked with answered yes. Who here has heard of fecal microbiota transplant? Great. The premise is simple. You take healthy stool from a donor and you deliver it to the colon of a sick patient. So when I say eating poop, I mean literally that, except I like to think of it as a super probiotic. In our case, we take screened stool from some of the happiest, healthiest, magical unicorn donors the Western world has to offer. Thank you, Portland. And we transform their stool into FMT, or fecal microbiota transplant capsules. The process is actually much simpler than you're thinking. As somebody who worked for years as a molecular biologist, worrying about contamination, degradation, what I do now is extremely straightforward. In a lab, under a hood, using sterile technique, we transform rigorously screened stool into frozen oral FMT capsules, ready for patients that have a disease called Clostridium difficile infection that's antibiotic resistant. So, a quick side note about C. diff. It is a nasty, nasty infection. In fact, it has probably quickened the pulses of many of the healthcare providers in this room, just mentioning it. It affects over 500,000 people annually in the United States, and it costs the US healthcare system upwards of $6.3 billion. So yes, C. diff is a vicious, diarrhea-inducing, antibiotic-resistant infection, and the worst part about it is that antibiotic resistance is on the rise, and it affects elderly. So what happens with FMT? Well, that part is pretty remarkable. These patients with antibiotic-resistant C. diff who have been suffering for months with 3 to 30 watery stools a day swallow a dose of frozen oral FMT capsules and their C. diff goes away. It sometimes takes less than 24 hours for them to have their first formed bowel movement and they get their life back. So I know you're thinking, this sounds crazy. Where did this idea come from? But the 4th century Chinese literature mentions yellow soup. And it was actually used in the United States in 1958 to treat pseudomembranous colitis. Since then, physicians throughout the world have been using FMT to treat C. diff, and now there is a robust body of evidence that shows it is both extremely safe and very efficacious to treat this form of resistant and recurrent C. diff infection. The data that I am most excited about, and it was recently published, shows that FMT capsules are 96.2% effective at treating C. diff. That is incredible. And even more, it is equally effective as colonoscopic delivery. So, looking at all this data and these headlines, I often can't help but thinking to myself, if FMT fit more uniformly into the pharmaceutical model, would C. diff be a disease of the past? But market drivers aside, my idealism drives me to continue educating people about FMT in the hopes that by providing access, we can continue to provide patients who need it the most with this extremely important tool. So back to the title of my talk, you might be thinking, The Human Holobiont, a Philosophy of Medicine Through the Lens of the Microbiome. That is the umbrella of all of this work with FMT in patients. What we have done in microbiome research in the past decade has been incredible. I like to think of the analogy that we were looking around a room thinking it was the whole world, and someone discovered a window. We looked at that window and realized there was an entirely new world, the world of the human microbiome, and that has fundamentally changed what it means to be human. So as you start to look at that world, we think about what is going on with this interplay of the microbiome and the humans themselves. The lens of the microbiome is starting to allow us to approach medicine in a new way, to look at medicine through the lens of an ecosystem. We are not just human. We are actually a complex ecosystem of many species working together. We are holobionts. So my challenge to you is to think about us as not just ourselves. And when we start to think of ourselves as more than just ourselves, it starts to make a little bit more sense that people are willing to eat poop for the sake of their health.
Great job, Andrea. Thank you so much.